Thanks for joining me on Med School Radio, where we think about topics we're likely to see on the USMLE. Hello everyone, welcome back to Med School Radio. Today we're going to be talking about a new subject. It is multiple endocrine neoplasia, and there are three types you need to remember. It's type 1, type 2A, and type 2B. And the way a question may be presented to you is to present one or two parts of one of these types of MEN and ask you in a workup what else should be looked for. So let's talk about these three types and see if you remember what they are. So first, let's start with type 1, MEN type 1. Do you remember what that was? So these are the three Ps. It's primary hyperparathyroidism, pituitary tumors, and pancreatic tumors. So when you think of a primary hyperparathyroid problem, think of parathyroid adenomas or hyperplasia. And if it's pituitary tumor, think of a problem with prolactin or visual defects. Remember that with a pituitary tumor, you have the tumor that could be pressing on the optic chiasm and causing a problem, and you'd get bitemporal hemianopsia. Next is pancreatic tumors, and in this case, you have to think about gastrinomas. Okay, what about the next type? Type 2A. Type 2A is medullary thyroid cancer. So think about calcitonin, also pheochromocytoma, and primary hyperparathyroidism. So with primary hyperparathyroidism, remember you have to think about parathyroid hyperplasia. And the next one is type 2B. Now with type 2B, the first two are the same as type 2A, which is medullary thyroid cancer, think about calcitonin, and pheochromocytoma. And the third one is mucosal neuromas or marfanoid habitus. So there we have it, these three types, or you could say there are two types, depending on how you look at it. Type 1, type 2A, and type 2B. So you may be asked about a patient who comes in with some problems, and it could be mentioned that some of the symptoms stemming from a couple of the problems in one of the MEN types. For example, in type 2A, you might see problems with the medullary thyroid cancer or pheochromocytoma, and they may ask what else you should be looking for. And so that you would say you look for a problem with the parathyroid because you think it was a type 2A problem. So let's just think about this again and try to remember what these are. So let's think again. Type 1, think about the three Ps. What are those three Ps? Primary hyperparathyroidism, think about the parathyroid. Next, pituitary tumors and pancreatic tumors. Now the next two, type 2A and type 2B, are similar in that two of them are the same and then have one that's different. So first for type 2A, we have medullary thyroid cancer and pheochromocytoma. And for 2A, we have primary hyperparathyroidism, which is what we see in type 1, remember? And now for type 2, the first two are the same as type 2A, which is medullary thyroid cancer and pheochromocytoma. And the third one is mucosal neuromas / marfanoid habitus. So thanks very much for tuning in. Today we looked at multiple endocrine neoplasia. This is Med School Radio.